All right, sounds great. All right, so we'll start off right now. Hello, everyone. This is Conversations with Rob. We are on the radio, and we have doing our podcast also online on YouTube. So thanks, everyone, for listening. Please subscribe and like our podcast. I have a special guest today, Dr. Saundra Dalton-Smith. All right, she's been on many platforms. She's been on CBS, Fox, Women's Day. That's just to name a few, also MSNBC. And she's wrote a book called Sacred Rest, Recover Your Life, and Renew Your Energy and Restore Your Sanity. So Dr. Smith, thanks so much for coming on. I really appreciate it.
Hi, thanks for having me.
All right, so let's talk about, first of all, in a world that, we see now this war in Iran may be starting, people are working 2 or 3 jobs, college kids, such as me, just got done with my master's degree, we're in student debt. How do you tell people like that to relax and kind of calm down when they're just trying to make ends meet and better themselves?
Well, that's the thing. Rest is more than just relaxing. It's allowing yourself to be restored in whatever area that you're feeling drained in. And so most of the time, people who are very high stress, high achievers, they have a lot of things that they want to accomplish, but they often feel limited because they don't feel like they have the energy to do that. And so that's where rest comes in. It really helps you to be able to do the things you want to do, to actually be able to do them without having to expel so much energy, because you feel as if you have what you need to get the job done.
Right. So how do people, change their lives, especially if they're dealing with, that type of job where, are a middle income, or they're working at McDonald's or fast food retail, whatever it may be, where their hours kind of fluctuate. They may not get as much sleep. They're kind of catching up every day. What would you tell somebody like that of how to, rest and kind of recover their mind, body, and soul in general?
Well, it starts off by not thinking about it as needing to take a vacation. I think that's where a lot of people, they start thinking, oh, well, I don't have time to take a sabbatical or take a week off from work. I've got to keep doing all these things I have to get done. But rest can be done in small chunks throughout the day. So let's take that person who may be working 3 jobs. Most of the time, someone like that also has a lot of neck pain, back pain, their legs hurt, they're achy, their head's fuzzy, they try to lay down to go to sleep and their mind's racing, they have all this stuff going on. Well, they don't have to take a vacation to fix that. They can start with something as basic as, let's say that morning they wake up, all of a sudden they can tell that their neck muscles are tight, or that they're having kind of tension-related type headaches. You can start with just starting to think about, how am I sitting during the day? What are my body ergonomics with whatever I'm working with? If you're students sitting at a computer, that could be as simple as taking some time to just do some neck stretches and neck rolls and those kind of things when you start feeling those muscles tighten up. Rather than trying to just ignore it and push through, actually address it, deal with it, and try to start getting some restoration with some simple techniques throughout the day. If it's that fuzzy mind where you feel like you're not being able to concentrate, many people do a lot of multitasking. So they have their thought processes scattered in multiple different ways, which actually is more draining than just having some focused attention to focus on whatever that activity they're trying to do, get it done, and then go on to another activity. You actually expel less energy that way than trying to think here, and then you have all these different kind of things in the air at the same time, and it's just pulling on your mental space even more.
Right. Well, you're right, because I see a lot of jobs now, they have that kind of stand-up computer, the little stand-up desk. I don't know the exact terminology, but I've seen that now. But to just keep going into that, do you feel like it's a problem though in American society? You look at Europe, and a lot of they have shorter work weeks. They have more paid vacation. Maternity leave gets paid for. Paid vacations. Do you feel like it's just kind of our country? And this is nothing against our country, but we look at other countries where they have those kind of luxuries and they're working shorter hour weeks, and they do get those paid vacations and other stuff. So do you feel like it's American society in general?
Well, we do have a kind of grind mentality. Our thought process is that rest is for the weak and lazy, and those of us who are successful can just grind it out. And then on the flip side of that, when you see people who are successful, most of them don't do as much work as the people who are not as successful. So how's that working for people? Because the reality is, to have a life that you actually feel is successful means that you're not grinding 24/7, that you do have some time to be able to relax and to wind down and to be able to rest.
Right.
So it's a it's a mindset shift, but that's the reason why so many, particularly millennials and teens, are getting to burnout faster than everyone else, because they're coming up into a generation where rest is the bad guy and grinding is the norm. And so what happens with that is that you get to a culture that is consistently burned out. So innovation goes down, creativity goes down, because all of these are things that come out of rest. When the mind has a chance to be able to be renewed and rejuvenated and regenerated, and the neurons kind of get regenerated, all of that comes from that downtime. And so when we take that away, and then we wonder why we're not having as many creative ideas, why people tend to get to these, what we call writer's block or creative blocks, all of that comes back to that burned out lifestyle.
Right. No, I agree with you 100%, especially as a millennial myself. I do agree with you that. So let's talk about, when you coach somebody and you do coaching, how do you coach somebody that's that type of person that's always go, they look at their cell phone at night. We hear a lot about, people that look at their cell phones at night, the blue light, or I think that's what it's called, but the blue light, it affects the sleep patterns and stuff like that. So how do you teach somebody like me that's, and my generation and the generation under that, always looking for their phone, always on Instagram, Facebook, and before they go to bed, they're reading the news or watching YouTube videos. How do you try to, get that habit out of my mind, I guess, and people like that?
Honestly, it's like a detoxing, because I find that when we first get started with the process of, and really that's the sensory part of rest. I talk about rest having 7 different components. Right. Well, sensory rest is one that really gets drained in people who tend to have a lot of time on their gadgets, whether it's their computers or cell phones, iPads, whatever it is. And so the thing with that is most people aren't aware of how their gadgets actually keep them in a chronically kind of overstressed sensory state. Right. If you think about it, when your notifications go off or when your phone pings or something like that, most of us kind of automatically feel like this urgency to answer it, to check it, to look at it. And so your body stays in this low level kind of pressure where you're always kind of looking at, I need to check and see what, who's texting me, who's calling me, who just sent an email. It's this urgency. And so that keeps the body chronically stressed just because of the gadgets. Almost instead of them being things that we're controlling, they become something that's controlling us, controlling our behaviors and controlling our patterns. And so it really starts with the first thing I tend to have all of my clients do is to take a rest assessment. You have to find out which of the 7 types of rest you're deficient in. So I have them go to the free assessment at restquiz.com. They take the assessment, find out which of the 7 they're actually deficient in. And then depending on what comes back, we kind of hit that particular problem. But I find that almost all of us have some level of sensory overload we're experiencing just from the electronics. And that's just kind of a detoxification. Small periods of the day where you're going to do without the phone. I think meal times are probably the easiest to start with. If you go to a restaurant, how many times do you see people sitting there instead of talking to whoever's at the table with them? Yeah. They're all with their gadgets kind of going at it. Just kind of retraining yourself to get back to that mindset that we can talk face to face. We can look at each other's eyes. I find it very funny, and I'm guilty of this sometimes too. I'll be sitting there and particularly before I started kind of thinking about the intentionality of rest, I'd be sitting there with my husband and I text him something and he's just in the other room. And it's like, this isn't good.
That's not good, yeah. Well, I mean, you see people my age all the time, and if you deal with people my age, even younger than me, more so I feel like the people that are younger than me, I'm 30 years old, just turned 30, but the people in their 20s or in their teens, you walk by them, and I used to see that on my college campus. If they didn't want to say hi to you, they'd look down at their phone and then wait till they go past you, and then they look up again. So, yeah, I mean,
it's become Yes, it definitely has become a social crutch for most people. I have 2 teen boys. When I go on their school, I'm just amazed at how little eye contact there is among teens. And so, like you said, everyone's kind of looking down, and now they have an excuse to look down. And that's an age where really you start learning how to express yourself, how to be comfortable in your own body, how to kind of claim your space. Well, now we have a lot of kids who are coming out of high school, going into college with this kind of inability to connect with the world on a deeper way, because they have not learned really how to be face to face with people. So then it's not surprising when someone walks into school and shoots up half the people in there, because they don't connect. There is no social connection there. You know, the humanity part of that comes with the face to face, being able to look in someone's face, look in their eyes, see their emotions, see how your words are hitting them. You know, and that's one of the most dangerous things, I think, really about social media. I know I've seen it numerous times where you'll see someone make a comment and you're thinking, how can someone say something so horrific to another person? It's because they don't see how their words hit.
Right.
It's one thing when you say something horrible to someone and you see them kind of retract and flinch back from that. It's another thing when you don't see nothing. You can say a lot of horrible things to people if you never see how how they respond to your words.
Right. Well, it is the inept, of the social interaction, because like you said, it's not even just, like you said, you people walking by people. It's also somebody goes into a job interview. If they don't know how to connect and look at somebody face to face and in the eyes to say, they're the best for that position, then, I don't know what job they're going to get. It's really sad that, these are the new leaders of our country, the kids growing up, and I don't know. I fear for that, but we'll move on to another topic that's more geared toward you. I hear a lot in the news about, age expectancy in this country dropping to 78 years old, all the new technologies, all the new medicines that we have out, you being a doctor, and kind of this has to do with rest too. Do you feel like that has an issue with the age expectancy rate going down, health problems occurring because people don't know how to relax, people don't know how to rest and kind of, get everything out of their mind and just zone out and reflect?
Yes, I think a huge part of that, one of the big things that hit probably about 10 years ago, we had the whole sleep revolution kind of that hit. I think what that did was it helped people see that we have a huge sleep deprivation in our country. But what it didn't help people to see was that you can't just take an Ambien or take a Xanax or take whatever it is and knock yourself out and then say, oh, I got sleep, so now I'm fixed, I'm ready to go. The whole issue about the sleep was really about learning how to get your body into a state where it could go to sleep. Yeah. And that's what rest does. So we skipped over kind of the pathway to sleep and went straight to the end result, kind of our microwave mindset. Let's just get to the sleep. And if we get to the sleep, then that'll fix everything. But we ran right by the whole process that we needed to learn to really be able to help heal our country. And so now we have people who are sleeping better, medicated or not, they're sleeping better. They understand that they need to get sleep, but they still have not learned how to actually live a lifestyle that is conducive to staying in a place of rest, where their blood pressure is not high all the time, where your phone pinging is not causing your heart rate to jump up 20 times in an hour, where you're learning the things necessary to unwind and clear your mind, where you're not burning all your neurons in your brain and getting to early Alzheimer because you never have any clear space in your mental capacity. It's always full of things going on. So I think that's what we're seeing. We're seeing a large number of people who, although they have very successful lives, their body is slowly being worn down because of their lifestyle.
So Doc, since you touched on it, and then I want to go into your book after this question, you touched on the sleep aid and all, and they have all these different medications. You go into Walgreens, CVS, whatever it may be, non-prescription stuff go on there. What do you think about people like you kind of touched on it a little bit, but people depending on all these sleep aids, and as you said, it's not the right kind of sleep that they're getting. They're not like recharging themselves. It's just putting them to sleep. Isn't there a different type of sleep? There's one naturally, and then there's one, medicated.
It is. And really the difference is the stages of sleep that you go in,
Right.
whether you allow yourself to kind of go through the process. There's REM and non-REM, and then non-REM, you have stage 1, 2, 3, and 4. So what I find is, and what a lot of the studies and the science is showing, when someone has a medicated sleep, they don't have the REM, they don't really get the restorative sleep. They just kind of jump past all the goodness of sleep and just get knocked out. It's kind of like getting anesthesia. When you wake up from anesthesia, you're groggy. You don't really know what's going on.
Right,
You're not clear. It's not like when you wake up from a refreshing restorative sleep where you're like happy and energized and ready to go. People, I won't name any names, but I think most of us are aware of a celebrity that even blamed one of these drugs for typing something, that got her in a lot of trouble, on social media. And the reality is those drugs do make you not as sharp. You're not as clear-headed as you could be because those medicines stay in your system. Right. And it doesn't give you the same type of clarity that you would get from a higher quality sleep. I think it's fine to use those in rare occasions. Death of a family member. You're distraught. You can't turn your emotions off like a light switch. Mm-hmm. You need something, and I've had people who have situations like that where they didn't sleep for 2-3 days. They're so distraught that they need something to help them shut down. I think there's a place for those drugs. I just think they've now become a crutch and a lifestyle rather than just doing the needed work of just slowing down and getting back to understanding the rest.
Well, Doc, isn't it true that if you keep using those consistently over a long period of time, the body just kind of, gets used to it, and you have to take a bigger dosage? Is that correct?
That's very true. Same as with, narcotic pills, but it's the exact same philosophy around the benzodiazepines. A lot of the sedative type drugs is that when you start off, let's say at a 0.5 of a Xanax, after 10 years, 0.5 is going to be like taking a Tic Tac. Now you need a 2 milligram because your body is just like, I don't feel anything when I take that lower dose. And then some of the other drugs, they have what we call continuous or extended release to try to allow your body to kind of utilize the drug in an 8-hour period. So it doesn't just hit you and knock you out, kind of slowly takes you in, slowly takes you out. Those tend to be less of a harsh effect on the body and how you respond to them. So most people are able to actually wake up from those and feel a little bit more refreshed. Like I said, I think there's a place for those drugs. It's just they're not supposed to be your day-to-day, this is how I sleep and I can't sleep any other kind of way.
Right. So let's just get a little bit about you, and then we'll go jump into the book. What made you want to go into to be a doctor in the medical profession?
I can't think of anything I've ever wanted to do other than being a physician. So that's a hard question for me because I don't remember a time I didn't want to be a doctor.
Oh, wow.
I can remember being a child doing the old operation kit. I might be dating myself. I don't even know if they have that anymore. Where you have this little body and they put these little things and you take the tweezers and if you hit the
I know what it is.
So I fell in love with that as a child, and I honestly cannot recall wanting to do anything else. But really, the profession for me has changed a lot. I mean, I've been practicing medicine now for over 20 years. When I first started practicing medicine, it was really all about just the treating. Diagnose, treat, diagnose, treat. So that was the focus. And I really feel that is getting away from what healthcare really should have been from the beginning. Now we're kind of moving more toward the preventative and how do we keep from getting to the point where we need to diagnose anything? Right. How do we keep people healthy enough that this treating is kind of the last resort? It's not the first step. We're not automatically saying, oh, you have high blood pressure. Let me give you 5 pills and saying, oh, you have high blood pressure. How much caffeine are you drinking? Are you staying up too late at night? How much salt do you put on your food? We've gotten away from those kind of questions that will keep us from putting more toxic things in people's bodies and just throwing pills at them.
That's what happened with the opioid. Sorry to interrupt you.
Oh,
no, I was just going to say that's what the opioid crisis started, giving out pills and pills and pills. People get addicted to it, as you stated earlier on in the interview. And then all of a sudden they're looking for pills everywhere and they end up killing themselves, which it's really sad, and that's still going on in our country.
It is, and really the opioid crisis, I'm not sure how we fix that, to be honest with you. It is such a monumental issue right now that I think that the best we can do is try to kind of stop the bleeding. So let's not keep adding on people to the crisis, and then try to help the people who are already addicted find the help they need to try to detox off of some of these drugs, or to find things that are less mind altering that will allow them to get back to a place of healing and health. But it is, and unfortunately, it's not just the opioid crisis we're seeing because people actually go after these pills once they get hooked on them. But it's with so many other drugs. I mean, when I get someone who's 60, as an internist, I see a lot of people that are 65 and older. And so when I refer a patient that's 65 and they already have like 15 pill bottles that they're bringing in with me at the first appointment,
Jeez,
they think I've lost my mind when I'm saying, you're not taking that anymore, you're not taking that anymore, because every doctor they've seen is not just added more pills, rather than actually look at and say, these do the same thing. Why do you need to take two of this same type of beta blocker? It's not necessary. So there's a whole kind of change of mindset that has to happen in medicine, I think, to really get us back to where we have people living to be 85 and 95, because we're not overdosing them with medicines that we say are supposed to help them.
Right. No, I agree. And I was going to start about the book, but I have one more question about healthcare, since we stumbled into this topic more so on healthcare. Health before impeachment and before the Iran crisis, healthcare was the big issue. It was in 2018 in our elections, and it's going to probably get back in 2020 in the presidential election. You're a doctor, so I have to ask you this. I am big in politics. And I've seen the issues in as you kind of just stated a lot of them. We talked about the opioid crisis, but there's so many terrible things going on in our healthcare system. Obamacare was good. I was on it. It did help me out and lowered the cost for a little bit for me. But we still are seeing seniors and people my age who are paying really high prices for healthcare, high prices to see the doctor. As a person that's in the medical field, what can we do to fix the crisis of healthcare, not just with the pills, which you did touch on, but in the care, the quality of care, the prices? Is Medicare for all the solution? We've seen that all over the world, and some places it works well, some places it doesn't. What is your solution to healthcare in our country?
I don't know if I have a solution. That's such a humongous problem. But my thoughts on that are that, when I look at the current healthcare crisis as a physician, I mean, just to give you an example, my normal day-to-day when I'm working with patients, about 60% of my time is patient care. About 30% of my time is dealing with computerized stuff. And then about 10% of my time is fighting with insurance companies. And so how can I give, when I should be teaching and having time to instruct and inform patients and helping them be able to even help themselves so that there's less of a pull on the healthcare system, I'm then having to fight with an insurance company about this pill versus that pill versus the generic versus do they need this test? Do they not need this test? Is there a cheaper way you can do this? There's all of this other stuff going on. And then when I finally think I found the right pill for a patient, then they call and say, that pill's $500 a month. So now we start all over again. They can't afford $500 a month for one tablet. So it's a mess. Is where we're at. It's a mess.
These seniors cutting pills in half, Doc. We talked about seniors, they're cutting pills in half. That's disgraceful in the richest country in the world.
Make it laugh.
Yeah.
So when I think about the healthcare system, there's so many different parts to it. I feel like we really have to get some control over the cost of medicines. I don't think it's reasonable that pills that have been on the market forever should still be so expensive people can't afford them. There has to be some, I mean, we're a culture that's able to mass produce everything, it seems, but we can't figure out a way to safely mass produce pills. So that's not logical to me. So and then when I flip it around and I get a drug rep that comes into me and gives me this full, press marketing on this new drug, I'm like, can we just forget the marketing and just get the pill down to a reasonable cost? But
Right.
it doesn't feel like anybody's monitoring that or really getting a control over that, because it just keeps staying big business and not healthcare.
Yeah.
And as long as it stays big business, people are going to lose out.
You're 100% right. I 100% agree with you. And I think it's just disgusting. As I said, the richest country in the world, people are dying 78 years old or less. There's big discrepancies. Like I said, seniors cutting pills, people my age not being able to afford healthcare. Healthcare should be a right. And in my opinion, we should be able to take care of each other. And that's, in my mind, that's what God taught us. Jesus taught us to take care of each other. But that's my little piece of political advice. Anyway, so we'll move on to more about you. So what made you talked about why you wanted to go into medicine. What made you want to write the book, 7 different types of rest?
Yeah, Sacred Rest. I wrote it because honestly, I burned out. All this talk about 20 years of practicing medicine, I gave you kind of a framework of what my day-to-day looks like.
Yeah.
And honestly, my very first book, Set Free to Live Free, I wrote that book because I was in the room with a patient, and I had the conversation with her. And once we were done, I left that room, and immediately I was like, oh, okay, well, what she needs is this, which was kind of a whole education on what her disease process was, which was probably going to take me 20 minutes. And I was already behind schedule. so that wasn't going to happen, because then I'd been there all night and I had kids to pick up the daycare. So, and in my head, I was thinking, well, I'll just give her this pill and that'll hold her till I can get her back in a month. And I was so convicted from that thought process, because that is not the medicine I wanted to do. And that was 10 years ago. I was like, that is not the medicine I wanted to do. And it was right around that time healthcare was changing, where it was this huge pressure to see more patients. Medicare cost the doctors had gotten cut. So working, like I said, medicine's business. So working within a physician group, there were certain quotas I had to kind of keep up with and all this stuff. And I got to that point where I thought, if I can't actually physically sit down and explain to people what I want to explain to them, I need to be able to give them something when they leave, so that I can say everything I want to say in that paper. So I started writing up these kind of short takes on most of the major diseases. I had one for headaches that went over the natural things you can do, that went over why headaches come. I had one for blood pressure, diabetes, you name it. I had come up with kind of these this is before they had the patient education pamphlets that everybody does now. This was just when I first started doing that, because I felt like I need to be able to give people a little bit more information, because I don't want to have to keep throwing pills at them. And that kind of led to a book. And then one of the main questions people kept coming in and saying to me is, why am I so tired all the time? And is my thyroid, my adrenals messed up? So, and I do all this testing, everything would come back normal. And I started having some of the same feelings, because I was getting burned out from the work that I was doing. And I thought, this is more than just, it's not hormonal. Nobody's thyroid came back bad on the ones that I did. It was not hormonal. There was no adrenal issue going on that showed up in blood work. It was just the lifestyle people were living. And so I started kind of just treating myself with the research and looking at kind of how rest intersects with our lives, and then started taking some of that education back to my patients. Ultimately, it ended up in a book, and the quiz and all those other things to try to help more people.
Right. So what are the 7 different types of rest? If you can just tell the viewers, and the rest they'll have to read the book for.
Yeah. The 7 types of rest are the 3 everyone knows about usually are physical, the mental, and the spiritual. And the 4 that came out in the research that most people aren't as familiar with are emotional, sensory, social, and creative. And in the books, Sacred Rest, Recover Your Life, Renew Your Energy, Restore Your Sanity, what I talk about in there is really what each one of those looks like, and then how to get more of it, giving examples of, in the middle of a busy work day, in the process of being a student or being a stay-at-home mom or being a CEO, how do you get the rest you need without having to add more to your to-do list? Because I think when most people hear, oh my God, there's 7 types of rest, I don't have time for one type. So how am I going to get 7? I think it's important to understand that really most of us, we're not tired because we're lacking in all 7. We're tired because we're deficient in one of the 7. And the one we're deficient in is one we usually don't even know exists. I find that the largest number of people rest deficit tends to fall in either the sensory rest deficit, creative, or emotional. Those are the 3 that people tend to have the highest deficits in, and most have never even heard of it and don't know how to get more of it.
So 2 more questions. We hear a lot about yoga, meditation. It says, relax the mind, the body, and the soul. Do you believe that stuff really does anything, or is that just kind of some, gym thing?
Well, it depends. Yoga would be fine if your problem is a physical rest deficit. So physical rest has passive, which is sleep and napping, and then active, which are things like massage and yoga and stretching. So if your problem is that you've got these tight muscles from, stress, you hold your stress up in your neck and you kind of have these tight muscles, or your leg muscles are tight from sitting in a chair for 8 hours a day, then yeah, yoga might be very helpful for the physical part. There are some meditative components to yoga where you try to get your mind to go from the scatter, or what we call monkey brain, where you're jumping from one thought to another, where you kind of pull the thought down to a central focus. So that is a helpful thing for people who tend to have a mental rest deficit. But if your problem is, let's say, creative rest, let's say you're someone who works in IT, and you're having to come up with programs and design things and kind of pull things out of your creative space, that might not help you very much because you're draining your brain creatively. So now you need creative rest. You need time when you're allowing yourself to be awakened by either natural or other creative things. Creative rest really looks like, you probably may have experienced this. If you've ever gone to the beach or the mountains or the lake, and you just feel better when you're there, something about it inspires you and just makes you feel kind of at peace and relaxed. The science actually shows that people who feel like that around bodies of water, their MRIs of their brain actually have a chemical change that happens when they're looking at those types of scenes. And so that's what creative rest looks like. It's the rest or the restoration of your creative resources that comes when you allow yourself to appreciate beauty, whether that's natural beauty or man-made beauty, like at a museum or listening to a symphony or whatever it is that kind of awakens that inside of you.
Right. So a last question: if people do want, to have you coach them, how did they get a hold of you? Where can people get the book? And for those 2 subjects.
Yeah, the coaching, the best place to probably get in contact with me is at drdaltonsmith.com, just drdaltonsmith.com. It has a little chat function on there where you can actually chat back and forth, and we can kind of go back and forth to see if we're a good fit. As far as the book is available wherever books are sold. The title is Sacred Rest: Recover Your Life, Renew Your Energy, Restore Your Sanity. Obviously, it's on Amazon. Everything's on Amazon, but it's also at Barnes and Nobles and some other bookstores as well.
Right. And actually, just one more, I'm sorry, because you brought this up. So with the coaching, so when you talk back and forth, how do you find if somebody's a good fit or not? And then we'll end the interview. I appreciate you taking all this time.
Yeah. With the coaching, we actually have an application. And so the back and forth is just kind of getting the ball rolling, just to kind of gauge interest. And so that function is just to say, hey, I'm interested in coaching. And then we send an application to find out really if we're a good fit. Most of the people I work with consider themselves high achievers. If someone already kind of has a very relaxed lifestyle, I'm probably not the right coach for them, because if they're just wanting to learn how to relax deeper, I have a lot of people I can refer you to for that. The people I work to are people who are leading companies, the people who are running hospitals, the people who are innovative and at the top of their game. They're entrepreneurs, they're small business owners. These are people that are stressed out and they're at the end of their wits and they're needing kind of some rescue therapy. And so what we do is there's 2 different types. There's what we call Thrive Accelerator and then Thrive Elite. And the Elite's kind of more of a one-on-one type coaching thing where we really go deep into your personal life and how to restructure some things so that you're actually enjoying more of your life without having to quit your job, go on vacation, or take a sabbatical. And then the Accelerator program is a 90-day coaching program that's more of a group coaching that allows you to get some one-on-one feedback within the group, but it's a very structured process to take you from kind of this burned out, overwhelmed, overstressed lifestyle to one that has a lot more harmony. I don't use the word balance because I don't think balance, work-life balance exists. I think we have to have a work-rest ratio that allows for harmony in our lives.
Sounds great. So everybody, definitely check out the book. If you could just say it one more time and just for the viewers one more time.
Yeah, the book's Sacred Rest, Recover Your Life, Renew Your Energy, Restore Your Sanity. And then the website is drdaltonsmith.com, and that's DALTON Smith.com.
Dr. Dalton-Smith, it's been a pleasure. I will definitely send you this interview for you to watch, and I appreciate the time, and you're very knowledgeable, and hope to have you on another time sometime soon.
Thanks so much. It's been great. Have a great day.
Thanks so much. Bye-bye now.